employed by any organization. I work for myself as a solo practitioner. My history related to Gaza, I served there from April 15th to May 1st as a plastic surgeon at a number of institutions, and I did probably about 60 operations there. This was in May, and after returning, all that I could think about, on my way out, all that I could think was that I didn't want to leave. And then when I was back, all that I could think of was that I want to go back. So I made a second attempt to go back from July to September. I was not granted entrance into Gaza, so instead I went to the West Bank and I operated there. And the experiences that we have and the people that we meet through all these things that we face, we can take positive things from that and we can learn and we can share these experiences. So it was meant to happen, what happened. I wasn't meant to go in. I was meant to go to the West Bank. And now I can share those experiences with everyone. I do want to give a special dedication to this talk to a medical student that I worked with personally at the European Gaza Hospital. Abdul Rahman was a third-year medical student at Al-Azhar University. He was born September 6, 2003. He wanted to become a neurosurgeon. All of the medical schools, dental schools, and many of the other academic institutions in Gaza are destroyed. Their records are destroyed. Many of these students have no hope. The medical students, most of them moved into the hospitals to continue their educations with, unfortunately, hands-on experience. Abdul Rahman was part of the plastic surgery team at the European Gaza Hospital, and when the European Gaza Hospital was evacuated, he moved to another hospital, and he continued to move wherever he was displaced. He was killed on August 30th, 2024 at 1:45 a.m. when he was in the house of his aunt, visiting his aunt, and the building was struck by a missile. So just to share, these are human beings, okay? I would regularly exchange messages with Abdul Rahman. We were talking about what he felt. So I just wanted to read these messages to you. He said, we were talking about what he feels. So he made a statement, and I said, it sounds like you're really asking a question, not really making a statement. So he said, I suck with expressing my feelings, but I can sum most of them up in a question. If I could sum it up in a question, it would be, how can taking help while the reality, how can talking help while the reality is getting worse? So we were discussing, kind of connecting him with someone from psychology who he can discuss what he was feeling. So he's saying, if the reality is getting worse, what good is talking going to do? I know we are supposed to be strong and patient and hold on, and I am, but sometimes my human weakness overrules everything. I try to stop worrying about my future, but I can't. It's not just a switch that I can turn off. Allah said in the Quran, "La yukallifullahu nafsan illa wus'aha," that human souls are not burdened beyond their scope. But his humanity comes out, and he says, and yet I feel I'm already burdened from all of this. Does that mean I am that strong? Because trust me, I am not, even though I show the exact opposite. Another text, it's like an empty circle of mixed up feelings and thoughts, and it hurts knowing you can't do anything about them. Even though we're Muslims and we do count on Allah to try to be as patient as we can, but at the end of the day, we're all just humans, and humans are fragile creatures. I don't want to bore you with my grumpiness. Enough depression for today. So when the concept is floating out there that the people of Gaza love death, you can see the human side of them, and they want to be just like us. So just talking about education, SaveTheChildren.org has this, some stats on their website. Education under attack, nearly 90% of school buildings are damaged or destroyed. So while the children in the United States have gone back to school, and most of the world, the majority of the children in Gaza have no education. So what was my time in Gaza? So just so you know, there are some graphic pictures in the next 2 slides. So if you want to look away, and I'll let you know when they're over. So I got into Gaza through the Rafah border, and I quickly started treating patients. The patients on your left-hand side, wrapped up in gauze, is Hala. She's a 3-year-old child who was burned. And through her, I met Steve. And through her, Steve is here to share his experiences. So Hala was burned on over 30% of her body. I operated on her numerous times, and we tried getting her transferred out to the Shriners Hospital in Boston, which accepted her for the remainder of her care. But unfortunately, like most of the children and adults who have burns over 20, 30% of their body, she died. And she died one day before her passport was ready for her to be transferred out. You can see these patients and these extremities are very small. The wound in the middle, many of you are in the medical field, is an open tibial fracture with a blast injury and a sciatic nerve transection. This is on a 9-year-old girl, I believe, and then you have a 12-year-old boy with entry and exit wounds from a quadcopter injury to his back. And you would think that a patient like this would be admitted to the hospital if it was Stony Brook University Hospital, but this patient with a hole in his back and an external fixator on his arm lives in a tent, and he comes to an outpatient clinic to receive his care. So what did I witness there? I witnessed the destruction of human life, the destruction of families, the destruction of a healthcare system. This is a family displaced living in a stairwell in the European Gaza hospital, making bread, trying to live their life, trying to have some resemblance of hope and existence. And you have children sleeping in the middle of the hospital floor. So imagine walking through the hospital floors at the university hospital and just seeing people from the community laying out on sheets, behind hung sheets on the walls, and they're living behind there, and you're walking through the hallways. And there's sometimes even children riding bicycles through the hallways. Can we even imagine that? I saw the destruction of infrastructure, water facilities. I saw dehydration, starvation, the destruction of sanitation. And as we're here today to discuss healthcare, the destruction of healthcare infrastructure, where we're making these makeshift things so that we can operate in some safe manner. I also experienced the local surgeons, 3 of whom in this picture are local surgeons. Dr. Ahmed with his thumbs up was the chief of vascular surgery at Shifa Hospital. And other surgeons here, Dr. Haytham in the light blue scrubs was the general surgery working on the plastic surgery section, and his brother in the black shirt was a vascular surgeon also. I spent my days and nights with them, and the one meal we had every day together was a time when we spoke about their experiences and shared each other's humanity. So let's get to the facts, okay? So let's talk about healthcare, humanitarian aid, and perspective. So what perspective do we have? Our perspective is built on what we experience around us. What we experience is usually the stuff that is in our face the most. So mainstream media usually, maybe some newspapers, maybe some magazines, and the internet, obviously. And what's fact versus fiction? It's very hard to distinguish fact versus fiction. So Farah mentioned that we're going to talk about facts, okay? So let's talk about Gaza and the West Bank. So now I'm going to focus more on facts, cold facts, okay? So you can get an understanding of what's going on. So we regularly hear about the injuries and fatalities in Gaza, but what's being either suppressed or not reported on are the fatalities and the injuries occurring in the West Bank. So understand, after October 7th, everything coming into Palestinian territories, not just Gaza, was extremely limited. Not only material goods, but the taxes that were collected by the Israelis for the West Bank were not distributed to the healthcare workers as salaries in the West Bank. So surgical teams that were in the West Bank over a year ago doing procedures who are now back in the West Bank doing orthopedic procedures are operating in sub-West Bank standard conditions because the staff who was there 5 days a week now can only be there 2 days a week because they're not getting paid. And when they're getting paid, it's 30% less because some of the money has to go elsewhere to cover other expenses. So take a look at these. You can see since October 7th, there were 703 fatalities in the West Bank, something we don't regularly hear about, and close to 6,000 injuries. So look at these numbers. These are, can people see that? Okay. So this is a tax on healthcare. So think about, put yourself, Stony Brook University Hospital, it's outpatient clinics, it's patients, the ambulance drivers, the ambulance workers being attacked, okay? So let's try to put ourselves in this situation. So the number of attacks, and I'm not going to tell you which is which. So number of healthcare attacks, 504, number of healthcare attacks, 535. Where is that, the West Bank or Gaza? All right. Attack fatalities, now you start figuring it out where this is from. 752 attack fatalities on healthcare institutions, sounds like Gaza, right? But then look at ambulances attacked. 373 ambulances attacked versus 115, which is what? What are we hearing about? Where are these facts coming from? Am I making them up? Is this CNN? Is this Fox News? Do you hear about any of this stuff in any of the media that we're regularly exposed to, or even from healthcare workers in the United States who we take an oath to stand up for ethics, morals, and humanity? So I'll tell you, the bottom is the West Bank, the top is Gaza, okay? This is looking at both together. Total number of attacks, 1,039. So they're coming after healthcare institutions. Now let's really picture this, okay? This is Long Island, right? The map of Long Island, Nassau County, 13 hospitals, 5,691 hospital beds. According to the DOT, Department of Traffic, on the LIE daily, there are 21,000 trucks that are passing, right? So that's humanitarian aid. That's what we use from the morning when we wake up, our toothbrush, our towel, soap, detergent for our clothes, socks, underwear, shoes, clothes, toilet paper, feminine products. Those are what these trucks are carrying, things to build our homes, things to keep us safe. So Long Island alone, 21,000 trucks pass on the LIE daily. Sometimes it feels like that's how many trucks are around us when we're in traffic. All right. Population, Nassau County, 1.4 million. Suffolk County, let's not forget out here. We have 11 hospitals, population 1.5 million. All right. Now look at Long Island and think about what Gaza is. Imagine yourself living in an area between Manhasset, where my office is, and about the Hop Hog area, right? As north as Glen Cove, as south as kind of the Levittown area. Actually, this is wrong. As south as kind of the LIE. You put yourself in that 25 by 6 mile radius. Now imagine Queens built walls all around you. And those 21,000 trucks are not coming in. Pre-October, there were about 500 trucks coming in a day to a population larger than Nassau County of 2.1 million. These are facts. Okay, so put yourself in that situation and now look at this. This is what that area looks like. Population 2.1 million. 17 partially functioning hospitals with only 1,500 barely functioning hospital beds. I can tell you this because I was there. And you may ask where I'm getting all this information from, because I don't have references, and I did that intentionally. So what's coming in by trucks? Because in the news, we're hearing about all these trucks coming in and aid going up, but let's look at facts. Let's not look at tons. Let's look at how many trucks are coming in, because we know 21,000 trucks passing the LIE, right? September 1st to 15th, on average daily of humanitarian trucks coming in was 67. Facts. So let's talk about what we hear in the news. We hear about this great pier that we have and how we brought in 8,000 metric tons. First, they were talking about how many trucks were going in. And then as the pier started collapsing, they're like, okay, the number of trucks is sounding really small. Let's talk about tons. So now you think 8,000 tons, well, that's a lot. Okay, this pier cost us $230 million of our taxpayer money, right? But 8,000 tons or metric tons equates to about 600 to 700 trucks. So we paid $230 million of our taxpayer money to bring in about 700 trucks, which is about how much they need in one day to sustain a population of 2.1 million. I don't want to take away from other speakers' times. So now let's look at humanitarian aid and medical aid. How many people in this audience are in the medical field? How many are students? Okay, it's not a lot, but okay. So from, as of September 14th, from October, there's been about $70 million worth of aid total coming in. That's a third of what we spent on the pier. And then you can look at these charts and I'll tell you where you can get these charts, because this is what, as educated people, we should be looking at. We shouldn't be looking at commentary, because commentary is skewed. Okay, so what about humanitarian access? I was denied. We hear that everyone is getting in. We hear aids getting in. We hear aid workers are getting in unrestricted. Okay, so in August, look at how many, the blue shows how many aid workers are in, right? Or missions are in. It's about the same since March. And look at the number in orange of denied. This is because these aid organizations have to coordinate with CLA and now Shin Bet, which is the intelligence agency. All right. So these are the reports that we're flooded with when well, maybe I don't get my news from the places where the younger people get their news from, but if you use Google, and you look at news or Yahoo News, you'll come across these. What here shows that there's limitation in aid? This is all just commentary that's meant to distract you from facts. And especially as educated people, we have no excuse to look at commentary and have someone else think for us. Where do you get these facts? Go to the United Nations, to the OCHA website, the Office of Coordination of Humanitarian Affairs, that Steve works with and all humanitarian organizations work with to get aid and aid activity into Gaza, right? On this OCHA website, every week you get an update. What's going on? How many aid workers are in? What aid is in? How many trucks are in? Update yourself every week to really understand what the situation is. So they give you these snapshots of every week as to what's going on. Okay. They give you an idea, if you go to the World Health Organization, an idea of logistics and medical supplies. So stop going to these commentary websites. Avoid spending time listening to people argue back and forth about, what side's right, what side's wrong. Focus on facts. We're all really educated people here. Okay, so this is just showing my references because I took the references out in the beginning. So this applies to the work that Steve and HEAL Palestine does, right? They make an effort to save human lives, to bring people out, right? Even one human life is so enormous and has so much value, right? The number of evacuated cases since October stands at 5,033, with the tens of thousands of children who are injured. This is a very upsetting number and should be upsetting for any healthcare provider, regardless of where you stand politically. So let's look at where the aid is going, right? Since 1946 to 2024, your tax money from the United States has gone to these countries. And I want you to take a look at where our efforts collectively in this room, not everyone, because some people were probably born in the 2000s, but collectively as a United States population, where we're spending our money. And these are just some pictures. Oh, no, this is someone else's. I think that's all I have. I sit here. Oh, I guess question answer.
Yeah, no.
Okay.
Thank you for sharing your experiences. And I just have some questions for you.
Sure.
The first question is, what is the most pressing healthcare challenge that Gaza faces, especially during the last 11 months?
So if you remember that slide that I showed you, that only $70 million worth of aid has gone in since October, we're going on about a year. Think about the operating budgets of each individual hospital on Long Island, which exceeds that. And this is, you're talking about an entire territory. This is, I would say, everyone trapped behind those walls are hostages. Everyone has limitations in the access to care. Everyone is suffering. So I think a ceasefire is critical. Getting aid in unhindered is critical. And I think it's something that as a healthcare community, as an educated community, that we need to advocate for. And again, stay away from the commentary and focus on humanity and focus on the facts.
Thank you. And from a medical perspective, how do healthcare workers manage under the conditions that you've witnessed, and how can the global medical community better support their efforts?
I think as a global medical community, we haven't said enough. We haven't stood up enough for our colleagues, regardless of where they are in the world, and we don't do enough for them. Going to Gaza and spending time with these people, sleeping with them in the same room, you become their brothers. You become their brothers, their sisters. And we realize we really need to support each other more. And you can see the stories of the medical students who are displaced. They're working in the hospitals. They want to help human beings. They're there not getting paid. The doctors there are not getting paid. They're getting a meal a day and a place to stay, and they go see their families in their tents or their apartments where they're displaced to, maybe once a week on Friday. So they've committed 24/7 unpaid to taking care of their people.
And then just the last question is, can you share any specific instances you can remember where medical ethics were challenged due to the extreme circumstances in Gaza?
Me? Nope.
Yes, sir. Sorry about that. Can you hear me now? Okay. I'll just repeat the question. Can you share specific instances where medical ethics were challenged due to the extreme circumstances in Gaza?
So that goes along with, as healthcare workers are, as educated people, are we really being ethical? So I think ethics gets challenged on a daily basis. And I don't think it necessarily gets challenged from within Gaza. I think they're doing everything they can to preserve health and humanity. I think the responsibility for ethics and maintaining of ethics really falls on the people outside. who are looking at the atrocities that are happening on a daily basis and not pushing for a ceasefire.
Thank you.
Can you hear me now? Is that better? Yeah. Hi, everyone. So I have the pleasure of introducing our second speaker. Our second speaker is Steve Sosebee. He is currently the director and founder of HEAL Palestine. Through health, education, aid, and leadership, HEAL Palestine is working to provide every young Palestinian in Gaza a chance for a brighter future. HEAL Palestine is a non-political, non-profit humanitarian organization with leaders in more than 3 decades of building programs and projects in Palestine. With a background in journalism and over 30 years of experience supporting Palestinian healthcare initiatives, Steve has committed his career to addressing the needs of children injured by the tragedy of war. So welcome to Steve. Do you want to sit or stand? What do you prefer?
Okay. Okay. Well, first, I just want to say thank you to the organizers, Josh, and everyone for putting this together. Thank you, Dr. Sayeed, for your great presentation and the amazing work you've done. Tom, I'm very honored to be up here with you as well. And thank you guys for coming out. This is, it's a different time than when I started. I started my activism. I started as an activist. I come from Kent, Ohio, which some of us older guys can remember had a historical moment in American history back in 1970 when 4 students were killed by our National Guard troops entered. They were protesting the American invasion of Cambodia, the ongoing war in Vietnam. The National Guard was called, killed 4 students. And I grew up in that small town in Ohio, so we kind of were raised with a bit of awareness of politics and the world around us. And coming from that small town, when I started to see the first intifada and the same scenes of what was happening in Palestine, which was unarmed protesters were being shot by military persons, the Israeli army, it resonated with me more than it probably would with students from other universities. And that's when I decided to dedicate my life to the Palestinian cause and the Palestinian issue, mainly because for the very basic reason, there's 2 basic reasons. First and foremost is the fact that it's a human issue. It's an issue of justice and freedom, one that we were born with in this country, and that comes with a big responsibility. When you're born free, you have the responsibility to stand with those who are struggling for freedom. Our forefathers stood and sacrificed and struggled for us. And it's our duty and responsibility to stand for the rights of others, whether it's in this country, for those who are oppressed and continue to be oppressed in this country, our African-American brothers and sisters, others from different struggles, or abroad, where our government is denying people their freedom and their rights, their basic human rights. And that's the second issue. As an American, I felt it was my particular responsibility to stand with the Palestinians and do something for them, because it was my tax money. It was our tax money as Americans that would continue to provide the bombs, the aid, the vetoes at the UN, and all of the support that enabled the continued occupation of the Palestinian people. And now we're in the phase of genocide, what's happening in Gaza. So I just started my life serving the Palestinian cause back in 1988. I had the opportunity to go to the West Bank and Gaza and see with myself as a university student what was happening on the ground there. I met amazing people, the same experience that anybody who goes to Palestine with an open mind and an open heart will have the same experience, which is a very human experience. The Palestinian people, the Arab people are very warm, very open, very hospitable, very welcoming, and very courageous. And that moved me very deeply. And what also moved me was how harsh and brutal the occupation was that they were enduring and subjected to every single day. So I went back, finished my degree, went back to work as a journalist. I wanted to share the stories of everyday Palestinians to the American public, because I believe, I'm from a small town in Ohio. So I believe my neighbors, although they have very limited knowledge and very limited exposure to the world outside of the United States, and even, on a smaller scale than that, I think most Americans are decent. And if they were aware of the injustice which was happening on the ground in Palestine, and if they're aware of how our tax money was being used to oppress and subjugate and kill innocent people in the name of fighting terrorism or whatever else you want to call it, they would be opposed to it. So I wanted to educate people and just share stories as a journalist. And during the course of working as a journalist, I started to meet a lot of injured children who couldn't get medical care due to the poor health facilities under the Israeli occupation in the West Bank and in Gaza. And during the course of meeting those kids, I decided then I wanted to do more than just write words on paper. I started placing them in American hospitals, working with the Shriners and other institutions which accept kids for free, and started to bring kids over. And I realized at that time this was a great way, first and foremost, to help these kids who couldn't get care they otherwise needed. Otherwise, they should have treatment, which was, artificial limbs, plastic and reconstructive surgery, whatever kind of care that they deserve and needed was unavailable to them. We could provide it for free in American hospitals. Our health system, the way it's structured, it enables a CEO of a hospital, a medical director of a hospital, unlike in Europe, to accept children for free. It was not a governmental decision. It was an individual decision. So we took advantage. I decided to start taking advantage of that, reaching out to hospitals, getting our kids brought here and taken care of. So first and foremost, those kids got the care they needed. And then secondly, it was a way to organize our communities, because I'm an activist at heart. I believe strongly that it's important that our communities, all of us as individuals and collectively, work together to support people who are, again, struggling for freedom that's being denied by us as Americans. So bringing these kids here gave us as individuals collectively to rise up and support these kids. So we started placing them in hospitals. We reached out to our Arab communities, our Palestinian communities, and then the larger communities and say, hey, take care of them, house them, take them to their appointments, help support their needs. And then thirdly, it exposed this issue to Americans who otherwise, which is my intention to be a journalist, was to educate Americans. Kids coming into the communities where they're being treated initially was a great way to educate Americans, because when the first boy I brought in May of 1990, he was a triple amputee who had his legs and his hand, and he lost an eye from an Israeli bombing in the West Bank. He was on the front page of the Cleveland Plain Dealer. He was on the front page of the Akron Beacon Journal. He was on the television news, and it was the first time Americans saw the reality of what was happening. And they saw Palestinians as human beings for the first time, children, innocent children who were victims of our support and of victims of Israeli occupation. And that was important. That's, a major obstacle to overcome, because we're all aware, prior to the internet in particular, and even today, we don't get a clear representation or accurate portrayal of what's really happening on the ground there. Now with social media, for those who are, finding alternative sources, which Dr. Syed mentioned, we get a much more clear portrayal of what's really happening on the ground there. So we started, that was another reason to bring these kids. And then fourth, for all of us individually, I think we all have a purpose. We should seek a higher purpose in life, a spiritual purpose, a reason to be here, to have an impact in a positive way. I know many of you are medical students or in the health profession. That's a great way to do something for your fellow human beings. And I wasn't smart enough to be a doctor, so I decided to bring kids here and let doctors treat them. So it satisfied that need for me to find that place in the universe that I could feel good about myself. So I started and built an organization, a PCR, my first one, and started bringing kids here. And then when the genocide began, and I've been living in Palestine for many, many years. I speak a little bit of Arabic, depends on who you ask. My first wife was Palestinian. We were married for 17 years. I was the first American guy to marry a Palestinian woman in the West Bank. She helped build the first organization with me. Unfortunately, she got AML in 2009 and passed away. And I moved back again and lived in Palestine. I was forced to take a Palestinian passport, a Palestinian ID. So it's a weird thing for me as an American guy from a small town in Ohio to now live in the West Bank with a Palestinian ID and all of the restrictions that come with that. It is truly an apartheid state, and it's a weird exposure for me. I'm the most privileged specimen in the history of humanity. I'm a white American male. I hit the jackpot. There's no greater, really. And, again, it comes with an obligation. First and foremost, you stand with your brothers and sisters who've been denied the same privileges and have actually suffered from your privilege. It's my responsibility to stand with my brothers and sisters in that struggle. And again, Palestine to me is one of the areas that I was able to contribute and continue to contribute. So here we are today. In October, I've been living and working in Palestine for over 30 years. I know Gaza very well. That Gaza to me, that Gaza that back in 14 months ago, I got a car and drove from north to south by myself and knew every refugee camp and every road and had so many hundreds of friends. that I was able to visit along the way. That Gaza's gone. It's destroyed, and it may never be rebuilt. And that breaks my heart. But what's not been destroyed and which will never be destroyed is the spirit of the Gaza people and the Palestinian people. And that's what keeps us going, and that's what keeps me going. So the purpose that I felt I could best contribute in supporting and serving the Palestinian cause is addressing areas that would have an impact in the life of the people there. I think from a political point of view, we're very challenged in having an impact in this country to make a significant change in policy. That doesn't mean we don't protest. It doesn't mean we don't speak up. It doesn't mean we don't stand for justice and stand for the truth and stand for, with our brothers and sisters who are struggling for freedom. But we have to find a way to be most effective in that. And the way I felt I could be most effective is addressing defects and deficiencies and weaknesses in the healthcare system in Palestine. And what we were doing right before the genocide began in October was we were building a strategic initiative in Gaza where we had developed a medical advisory board of doctors like Dr. Sayeed, who had all firsthand experience on the ground through our medical teams. I'd sent thousands of doctors into the West Bank and Gaza over the years, and all of them have firsthand experience of what the needs are, who their colleagues are, how they could best support the developing of programs, because so many patients are dying there due to the lack of medical care. First and foremost is the lack of specialized services. Secondly was the lack of access to infrastructure, which could, cath labs and equipment and materials, which would enable them to get the kind of support and care that they needed. Shortages of beds, shortages of ventilators, shortages of intensive care units, so on and so forth. And then the denial of access outside of Gaza and the West Bank. They were denied permits to travel. Even 40, 50% of the children who had cancer and who have other diseases and other life-threatening illnesses were being denied the right to go to hospitals that had even accepted them for care. Even Israeli hospitals, which, by the way, are not treating Palestinians for free, they're treating them if you pay. Even those hospitals, which were getting a lot of money from the Palestinians, even they couldn't get patients from Gaza because the Israeli military was denying them the right to leave. So what we decided to do was identify every specialty and started addressing the weaknesses and gaps that we could start improving the quality of care so they would have a more developed and specialized healthcare system. And we were making great progress in neurosurgery. We had developed and built the first pediatric oncology department in Gaza, which for the first time, prior to us building that pediatric oncology department, which was privately funded, meaning that we did campaigns all over the world to raise the money to build it and to supply it and to staff it and to provide it all the chemotherapy drugs and training for doctors and so on, that before we built that, every single child in Gaza with cancer had to leave. And many of those children, as I just mentioned, were denied care. So children were dying just because they couldn't get treatment. So we built a cancer department, which, by the way, on November 5th was bombed by the Israeli military. And on November 7th, Rantisi Hospital, where we built that cancer department, was evacuated under the barrel of tanks. So that was our strategic plan up until October, which was identify all of the specialized services that are needed in Gaza, from cardiac surgery to every aspect of neonatal care, intensive care unit, pediatric intensive care, orthopedic surgery. And then within that, break down those subspecializations. What do you do with kids with club feet? What do you do with patients who have brain tumors, so on and so forth? Start focusing on how we could develop those services so those patients could be treated locally and not have to suffer the issue of being denied permission for care or getting substandard or inadequate care. And we were making progress. And then on October 7th, all of that was destroyed. And we may never get back to that point again where we could focus on developing a health system in Gaza that actually benefits the people and the health system there in an effective way. What we're doing now, why we started HEAL Palestine on January 1st, was there's much more. The situation in Gaza is so incredibly, I'm trying to find the right word because it's always difficult to come up with the right words on how do you express the impact that a genocide's having on an entire population. So every aspect of life in Gaza is destroyed. 90% of the population there are displaced, and many of them displaced 4, 5, 6, 7 times. 90% of the people are living in the streets, living in tents, living in their relatives' homes with 40 other people sharing a toilet, living in UN schools. All the schools are shut down. Not a single child has gone to school. Not a single student has gone to school. Not a graduate student, not a medical student, not a kindergarten has been run in Gaza since October 7th. What's the long-term impact? And here we are in year 2, starting second year school year. Those kids are not getting any education. And we all know that that's not something you can get back. Like if schools were open tomorrow in Gaza, and they're not, but let's say they were, even if you did an accelerated tutoring program and tried to get these kids caught up again for the year that they missed, it would not have the impact of bringing them back up to their peers in Israel or in Jordan or in Egypt or in the United States. So that's a permanent gap in that child's development, and you're never going to get it back. So that's what's happening in Gaza. The water treatment plants, there's raw sewage running in the streets now because the water treatment plant has been closed since October 9th. And so the lack of clean water is creating disease and creating the kind of suffering that we're seeing beyond the scale of what's been seen ever in the modern history. Today, we're faced with a very basic litmus test for people who claim to be humanitarians and who claim to stand for the basic principles of freedom and justice. Either you stand with the Palestinians and the people in Gaza today because their struggle is one of freedom and justice, or you're on the side of genocide. It's very basic. And again, Dr. Sayeed said, don't come up and give your opinion. I don't feel that that's an opinion any more than it was in any other cause in the history where people were subjected to the kind of destructive power that's being unleashed on the Gaza people today. They have no schools. They have no clean water. There's famine in the north. People are starving. Children have been starving to death. There's food insecurity. 75% of the children in Gaza do not have adequate daily nutrition that meets the basic requirement that is fundamental for their development. That's going to have long-term stunting, long-term development on their intellectual capabilities. And what the impact will that have for Gaza in the future? The health system's destroyed. As I mentioned, the cancer department that we were building, destroyed, not functioning. We were building an amputee program. We had developed a prosthetic program for the amputees in Gaza prior to October. We had developed a community of all kids with amputations in Gaza. We put them into a group. We developed a program for treating them. That system's destroyed because Hamad Hospital, where those prosthetic limbs were being built, is destroyed. We were building a new cath lab in Shifa Hospital to provide cardiac surgery, destroyed. So all of the services and more on, so on and so forth. I can go through all, I've worked at every single hospital in Gaza, the Indonesian hospital, Al-Aqsa Hospital, the European Gaza Hospital, I know very well. All those hospitals are either not functioning up to the level that is acceptable for the kind of hospital that they are, or they're shut down and they're closed and they're destroyed. So what do we do now? We decided on January 1st to start a new organization called HEAL Palestine, which is focused on health, education, aid, and leadership. And within those areas, we have two focuses. One is that we have the short-term immediate areas that we have to address to help people survive, to help people who are, children in particular, who are dying, who need medical care, who need humanitarian assistance. And then there's a long-term vision, because I've done more than 30 years in Palestine. I want to have a long-term impact and show that we can respond to this genocide as a community, because our governments aren't going to do it, to rebuild the lives of these children. The governments might come in eventually, God willing, there'll be a ceasefire, God willing, there'll be some kind of settlement of some kind that will enable us to rebuild Gaza. We hope it'll be a permanent peace solution. It's deserved for both peoples there. But if that doesn't happen, let's hope that they do rebuild Gaza, the infrastructure. Let the governments do that. That's what the Saudis do. It's what the Americans do. It's what the Europeans do. There's money to be made. They're happy to do it. Who's going to rebuild the lives of these kids? Who's going to take that responsibility? Who's going to stand and say, these children who've lost their limbs, lost their parents, can't walk anymore, have these diseases, who's going to rebuild their lives? It's on us. It's our responsibility. And that's the kind of organization we're building with HEAL Palestine. Dr. Sayeed put up some very graphic numbers and graphic statistics about the kid death and injured in Gaza and in the West Bank. And it's startling. And it should move anybody. Because do you know that 2% of the children in Gaza, 2%, have been killed since October 7th by American bombs? Dropped on their homes, dropped on their refugee camps, dropped on their mosques and churches, dropped on the hospitals. 2% of the children there have been killed in Gaza. But what those numbers don't tell you is how many children have died from the lack of adequate medical care. How many kids with cancer have died because they can't get chemotherapy drugs. Because that brand new modern pediatric oncology department that we opened in February of 2019 was bombed on November 5th, and those children with cancer can't get the care that they need. How many of the 500 babies born every year in Gaza with congenital heart disease no longer get open heart surgery, congenital heart surgery that they were otherwise able to get through organizations like ours, because those services aren't available anymore, but there's no specialized care. Those babies are dying. Those numbers aren't being reflected, but they are just as important and just as relevant as the children who are having their homes bombed. The children are being killed every single day. So the actual numbers of people who are dying, the 18,000 children that we know have been killed, and we know that there's a lot more than that because a lot of bodies have not been found. When you drop a 2,000-ton bomb, a 2,000-pound bomb on a house, American bomb, on a house in Gaza, quite frequently, no one ever finds the remains of those people. And we all know that half the population, nearly half the population of Gaza is children. So that's why we have statistics now where 2/3 of the casualties in Gaza are women and children. So what we're trying to do as an organization. It's more than just healing these children. We have a moral responsibility. We have an ethical responsibility as Americans, as human beings, to not let this genocide just turn as another issue that we'll move on to the next one. We have to be committed to repairing the lives of these kids. I was going to do a visual presentation, but then I just said, you know what? We have 3 kids here tonight who I want to tell their stories that our organization brought and are being cared for by the community. An amazing community here who've stepped up and taken them into their homes, take them to their appointments, have cared for them. One of them is going to speak, but I'm going to introduce her to you now. Her name is Sarah Abseso, and Sarah she'll tell her story, but we air flighted her out of Egypt. She was on death's door with severe burns all over her body. She'll tell her story, but her story is one I hope you'll listen to. Because not only are Sarah and her mom and her sister here, not only have they suffered this grave crime, again, American crime, that not only killed 2 of her brothers, but until now, her father and other family members remain in North Gaza. North Gaza is cut off completely from South Gaza, and it's under siege, and there's famine there. And as you all know, there's an outbreak of polio in Gaza, which is unacceptable in the modern world. Sarah is a fighter in the sense that she survived, even though she was under all normal statistics, she should have been dead following the injury that she endured. But because of her spirit, her courage, and her strength, she was able to overcome this terrible injury. And now she's here tonight to tell her story. We're very proud of her and we love her very much. The other young lady from Gaza who's here, who just arrived 2 weeks ago, and we were able to get her out with a group of other kids, which was a small fraction of children. Since May 5th, only 2 evacuations have happened of cases that have been able to come to the U.S. We've been involved in that. We brought 3 of them. The other one is 17-year-old Mara here in a wheelchair. And Mara lost both her legs in a bombing of her home. She suffered 2 bombings. The first bombing in North Gaza, where she's from, killed her brother and her sister's 2 babies. She showed me pictures of them today, and it broke my heart. And then she moved south. She fled south, and she was bombed again. And she lost both her legs above her knees. 17 years old. Come and meet them if you have a chance. They're beautiful, beautiful kids, and they have such beautiful spirit. And then the third, and she's here with her mom as well. God bless her. And her mom suffered injuries as well, as did her whole family. And then we have Shireen here, who is 10 years old, and Shireen lost her leg from a bombing above the knee, and her father was killed. And she's here with her sister Arij, and we were able to evacuate her and get her treatment here. All 3 of them are being treated in Long Island or Staten Island. Sarah was in the intensive care unit, the Staten Island Burn Center, for 3 months, getting amazing intensive care post-burn treatment that saved her life. And that's thanks to the doctors and nurses at that hospital. And we're very honored and very privileged to do this. But what's important to remember is that there's 10,000 children just like them in Gaza right now who can't get out and don't have access to care, that are having major complex surgeries if they're able to get medical care, often without pain medication, in some cases without anesthesia, and having recovered, going through a very painful and difficult recovery without pain medication. That's what these children are going through today because of our government, because of us as Americans. We have to accept that. This is our genocide. This isn't an Israeli genocide only. It's an American genocide, and we're Americans. So let's be honest and take responsibility for the crimes that's happening today in Gaza. If you don't want to accept that, then you're not accepting the facts. That's what's happening. This is on us. So when you meet Sarah and Shireen and Mara tonight, if you have a chance to, do what I did to Mara today and tell her sorry. I'm sorry. As an American, I'm sorry for what our government did and what our tax money did to you. And I'm sorry to Sarah, and I'm sorry to Shireen for what our country is doing to their people. It's shameful. And it's a historical crime. Never in the history of the world has there been a genocide that every day you wake up and you can see what's happening, and it's not changing. It's getting worse. And these people have nowhere to go. In Iraq, they could flee. I'm not diminishing what happened in Iraq or Syria or Ukraine or anywhere else, but those people could flee. The Gaza people have nowhere to go. We have 10 kids right now. Our organization has 10 children in Gaza who I have accepted in American hospitals waiting for them. I have a double amputee in Atlanta, 10 years old. We have a triple amputee going to Detroit, 12 years old. We have kids with all of these horrific injuries that can't get out. Why? Even the US State Department, who's intervening on their behalf, can't get the Israelis to allow them out. This is happening today, folks, every single day in 2024, soon to be 2025. We all know what's happening. It's all very blatant in front of you. The important thing is do something about it. There's organizations like HEAL, like Med Global, like so many organizations doing incredible work. Get involved, volunteer, do something. Don't stand idle. And first and foremost, don't be ignorant to the fact that this is our genocide, and we as Americans must carry this burden the rest of our lives. And that's why I said earlier, I'm committed, and our organization is committed to repairing the lives of these children until they're independent and can forge a future for themselves. We can't give Mara back her legs, but we can build her artificial legs, and we can educate her, and we can get her the psychological and mental health therapy to help her overcome as much as one can the trauma of losing your sister and your brother and their extended family the way she did. We can't bring Shireen's leg back that she lost, or her father, but we can give her an education, and we can get her walking again, and we can guide her along a path towards independence. That's what we have to take responsibility for, and that's what you can do as we all feel so hopeless and depressed, and even in some cases helpless about what's happening in Gaza today. Don't be. Justice always prevails, eventually. Sometimes it takes generations, sometimes it takes more than generations, but it will always prevail. One thing you want to be is on the right side of history. And right now it's a historical moment. And it's up to you to be on the right side of history. Standing with Palestine is not standing against the Jewish people. We have so many Jewish brothers and sisters standing with us. This is not a religious issue. It's not an issue of Semitism or anti-Semitism. It's an issue of justice. And freedom for the Palestinians is freedom for Israel as well. The burden of occupation is eroding the soul of the Israeli people. We see it. It's clear. And only by freeing the Palestinians will it free the Israelis of being occupiers and taking their rightful place in the international community. That's what's at stake today. Please stand with justice and freedom. Support organizations like HEAL Palestine, and do something for our kids. They deserve it. It's the least we can do to give them some sense of hope and a future. Thank you.
Thank you very much. So I just have a couple of questions. So one is, I mean, right now, the need in Gaza and the West Bank is so tremendous. How does HEAL Palestine balance sort of putting resources into solving the immediate need right now versus trying to do that long-term work that you talked about?
Yeah, that's a great question. We can't do our long-term work on the scale that we would like to until there is some stability and we start that post-genocide rebuilding phase in Gaza. So, you know, that significant impact in the leadership. So HEAL stands for Health, Education, Aid, and Leadership. The leadership L part can only take place when we're in a stable environment and we can start interacting in the lives of these kids. Right now, we're in an acute phase. And in the acute phase, you try to provide people the basic necessities of survival. So what we're doing now is just trying to help people survive with food, with medication, with clean water, with healthcare, mental health support. We're running a food kitchen that distributes 5,000 free meals a day. We're opening more kitchens in the north with the support of World Central Kitchen. They provide this food. We cook it and distribute it. We are opening makeshift classrooms in Gaza to help kids get some semblance of education. It's not anywhere near what they need or deserve, but it's something positive, and it's something that can have an impact in their lives in a positive way. We're doing mental health therapy on the ground in Gaza and in Egypt for traumatized children who've gotten out and are in exile. That's a huge challenge because every single Gazan, the 2.1 million figure that Dr. Sayeed put earlier, every single person is traumatized, every single one of them. What they've experienced and what they've endured for nearly a year now is beyond the scope of what any of us could possibly understand. The death, the destruction, the suffering, the hunger, the displacement, the insecurity. Every morning, we have two moms here from Gaza. We have Sarah's mom, Lena, and we have Mara's mom. And their husbands are back in Gaza, and their children are back in Gaza. And every morning they have to wake up and look at their phones and see if their family is still alive. None of us can understand the trauma of what that's like. None of us can relate to that kind of anxiety and that constant feeling of insecurity in their lives. And that's what they go through every single day. So we're trying to undo that, or at least balance that, or give people some semblance of coping skills or support through our mental health program. We're sending medical teams, and we have a field hospital in Gaza that we opened, one of the few medical facilities in Mawasi and Han Yunis, which is a so-called safe area, although there's been plenty of bombings and killings there. We're running a field hospital in Gaza as well, which is providing thousands of people medical care, in some cases even specialized medical care like radiology services, gynecology and obstetrics, excuse me, and lab services, which are otherwise not available because the health system's been utterly destroyed for the most part. So doing those kind of, to answer your question, to focus on areas that you can have a positive impact is really all we're going to do right now and can do, but the scale is enormous. It's beyond what any organization and even any government could possibly do under these circumstances. First and foremost is because aid is being denied, as Dr. Syed before. It's being denied. Imagine you have hunger, you have in some cases starvation in Gaza, and you have hundreds of trucks lined up in Egypt across the border with food, and children are starving. Where in the world has that happened? Where politicians or military people make a decision to let people starve rather than process foods with trucks to come in and feed them. That's what's happening in Gaza today. So aid is it's a political weapon. Unfortunately, everything is political in Palestine. Medical care is political. Clean water is political. Clean air is political. Education is political. Not because we want to make it political, because that's what it's become. So we have to operate under very challenging circumstances of being non-political in the sense that we give aid to anybody who needs it, any child who needs it. We don't ask them their religion. We don't ask them their politics or their identity for children. We just say, you're hungry, here's food. You need medical care, here's treatment. But everything is political in Palestine. The basic aspect of life is political, and that's the circumstances we have to operate under, and it's extremely challenging, as you can imagine.
So I did have one other question, but my thought is that because of the time, and we said we would make time for a break now to give space for people to go spend some time praying. We'll come back in 15 minutes, and perhaps the question that I'm going to ask now could be in the Q&A at the end. And it's really a question that maybe you can spend a few minutes during the Q&A talking about how people can help, even beyond donating to HEAL Palestine. What else can people do? So maybe we'll delay that to the Q&A at the end of the program, and let's take a 15-minute break now. People in the room, if you want to find a quiet place to pray, you can go through that way and turn left, and there's a series of doors with several quiet rooms. Anyone who wants to remain in the auditorium, feel free to do so. You can speak to your neighbors, get to know people around you, or spend time out in the atrium looking at the beautiful photographs, amazing photographs that Tom Lewendon has displayed out there. We'll come back in 15 minutes, 8 p.m. No, it's fine. I wanted to get to that, but I know that it's important.
Is this on? So we're going to be praying Salatul Maghrib in the hallway over here.
Getting Baba. Hard. I'm trying to find the Zoom tab. I think everything got lost. Oh, actually, wait, I found it. There you go.
Hello, everyone. We're going to get started again in about a minute. So if people could calmly filter into their seats again, that would be great.
Set a 30-minute timer.
Yeah, I would wait till.
Right.
Yeah, yeah. I think that there's too much on hold, so I wouldn't really finish.
I think I should sit for the, he's gonna stand up here.
Whatever you, yeah. I'm sitting there, I'm standing here and you sitting is fine.
Okay,
Whatever you-
except for the, no, I'll stand for the introduction.
I would stand for the
Yeah,
intro,
yeah,
who's gonna stand,
yeah.
but I only sat.
Right.
because who's- Yeah,
Yeah,
yeah.
No, just,
Yeah,
I think,
yeah.
yeah, okay, good.
Is Tom back? There he is, yeah.
Oh, yeah.
Yeah. Hello, everyone. Let's try and take our seats so we can get started again. Sorry to interrupt wonderful conversations. You can either use this or you could use this one.
Yeah, I needed to go. Okay, yeah, so that's it.
Okay, yeah, that's fine. That's a good question, yeah. Yeah, oh, wait.
Let me meet you again. Give me a second.
Oh, no, it was right.
Okay, hi guys. We're gonna resume the discussion. So if you can just go back to your seats, please. Thank you.
Hello, everyone. My name is Narmeen. I'm a third-year PhD student in the Department of Neurobiology and Behavior, and it's my pleasure to introduce Tom. So Tom Lewendon is a Berlin-based humanitarian documentary photographer who has recently worked in Ukraine and in Gaza. In Gaza, he volunteered twice this year with the medical humanitarian aid organization Med Global, serving as part of their media and communications team. His project, Children of Gaza, The Kites Still Fly, shares intimate stories through photos of children in displacement camps, hospitals, and mental health workshops. Welcome, Tom.
Thank you. Yeah, good evening, everyone. I am based in Berlin, but as you can tell by my accent, I'm definitely not German. I'm from the United Kingdom. Yeah, as you, well, first of all, I want to say thank you to everyone here and to Stony Brook University. I'm a little jet lagged. I will just, that's my excuse if I start to fumble my words.
I want to say thank you to Dr. Sayeed, who I met on my second mission to Gaza, who I now call a very close friend. Abina, Risa, Josh, and Narmeen, who's made this possible. And yeah, thank you so much for letting me speak. So just a little introduction to myself. I'm a humanitarian documentary photographer. I spent the last few years working in places in Ukraine, Berlin, where I live, documenting the impact of conflict and social crisis. In Ukraine, I was embedded again with humanitarian organizations, and I was documenting the, how can I say, the medevacing of soldiers and Ukrainian soldiers and of the civilians from the front lines, and also getting aid to the front lines, which is a lot easier in Ukraine as it is in Gaza. And also in Berlin, I was attached to an organization called the Culture Bus, which is called in English Cold Bus, and we would pick up homeless people off the streets and take them to shelters. And I will also say I also served in the British Army in a frontline infantry regiment. I served overseas in Northern Ireland in a peacekeeping role in 2005, 2006. So I only mention all these experiences because it profoundly shaped how I document human crisis and how I see the world in general. Despite everything I've witnessed and saw and experienced in all this over the years, what I experienced in Gaza was by far the most devastating situations I've ever encountered in all my life. The scale of suffering and destruction was overwhelming. Definitely too much for me to put into words, and that's why I take photos. But even through what many, myself included, would call hell on earth, and it definitely was, I saw humanity at its best. There was community, kindness, compassion, love, and resilience. I met people who I would now call friends. I speak to my Gazan friends every day through WhatsApp and Instagram, and yeah, I speak to them every day because they are my very close friends. So I have to do a little disclaimer. As you may know, Israel doesn't let international journalists into Gaza. So I went into Gaza with Med Global, as you said at the start in my introduction, as a media and communications department. So I would be documenting what Med Global does in Gaza, in Al-Aqsa Hospital, community-based mental health workshops, the nutritional centers, the primary health care centers. I had very unique access as a photographer there, and I'm not saying there's some fantastic journalists, local journalists, and I met them there, and amazing photographers in Gaza. But yeah, I had some very unique access that not many Western photographers or journalists had. So this year, I went twice to Gaza in March and April. Second mission, this is where I met Dr. Sayeed. And I spent a total of 5 weeks attached to Med Global. During that time, I had unique access to document places outside. I spent 8 nights embedded with the local international medical staff in Al-Aqsa Hospital. I also documented, like I said, the mental health workshops, nutritional centers, and I could even walk around the displacement camps and the beaches sometimes. So I'm going to just go towards the photos now and just start describing. So this photo here, you can see, this was taken very close to Al-Aqsa Hospital in April 2024. One of the Gazan med students, one of my friends told me about it, and she said I had to see it. In red, obviously there's definitely some Arabic speakers here, and you can correct me if I'm wrong, but I've definitely double checked this with a few of my friends. But in the red writing, it says that's my brother. Am I right here? That's my brother, and in blue, it's the name Katab. Katab. Okay. You would see these murals a lot, many with phone numbers on them because people are trapped in the rubble, and it's not just these a beautiful mural here, but there would be names and saying there's someone here, or they would say that the date they've been found, and you would see this all around Gaza. The next photo, I've forgotten. Okay, so, oh. So this was taken on my first visit to Al-Aqsa Hospital. This is in the resuscitation department. Yeah, this is an ER, specifically the resuscitation room, which I became very familiar with over the time I was there. This is a young girl. She was sleeping, exhausted. What you can't see outside the photo to the left, to the right, sorry, there is chaotic in this room, and there was an older male being resuscitated. He was dying, and it was chaotic in this room. But she was so exhausted, she just slept on the floor. And I asked the doctors and nurses, like, why should we wake her up? And they said, no, she needs to sleep. And it was one of my first sort of real shocking, memorable moments. Like I can't really explain. I wish I zoomed out, but there was so much going on around her, and she was just is that peace, symbol of peace, and she's sleeping in this chaotic environment. Yeah, so that's that photo here. This is the third actually, sorry. This was taken during my second visit, and also in Al-Aqsa Hospital in April in the pediatric department. This room here was normally just for private, like there's maybe one family, but there's about 6 families in this room. There was a big outbreak of hepatitis A, B, and C. So this is a lot of kids and adults who contracted that virus there. There was about 5 or 6 patients, and I spent a little bit of time around the pediatrics department talking to, not me, but I'd have my translator, another medical student who I commandeered to help me. But yeah, this is in Al-Aqsa Hospital. Slide, next one here. Okay, yeah, again, this is in a resuscitation room. This young boy I was told was actually hit by a vehicle, and this is an indirect effect of this war, because the displacement camps are so busy and so chaotic. You know, there's tents, and there's obviously there's roads, makeshift roads, but there's kids everywhere. You know, and sadly, you know, things like this don't need to happen. It's a needless injury. It wouldn't happen normally. But yeah, and he was hit by a vehicle, and he sadly passed away. This is my arrow now. So the Brenda in the top there, she's one of the American international volunteers for Med Global, and she was there in the resus room. The next slide, next photo. This gentleman here, he is one of the many unsung heroes. He's a volunteer security guard, but the amount of bodies and he took out those rooms, it was countless, and he was like the self-designated bearer. He would take them to the morgue. The morgue was full, and I don't know if you know this, but they started using old ice cream trucks as to keep obviously the bodies cool before they get buried. Okay. Again, sorry to repeat. I did spend a lot of time in Al-Aqsa, so there's a lot of my experience was there. And this is again from the resus department. These 2 young boys come in at the same time. The young boy on the left with the silver foil, he had major head injuries. He lost both his legs. And that's his brother, just out of picture. But what you can't see is that his brother's actually holding the drip for the other patient, not for his brother. Like, so he's still like his brother. He survived, and I need to double check, but I know that he is evacuated. I was going to speak to Steve after this and see if he was evacuated with HEAL. But he did get evacuated to the United States of America. And the young gentleman on the right sadly passed. And this is that young boy and his mother just before he was taken to surgery. So this is in the corridors of Al-Aqsa Hospital. Again, just chaotic. Many people sheltering in hospital. So many patients would have to, you know, if they're coming in, then their family be there to take care of them as well. And it's just the corridors, and there was no space for there's no space for anything really. It's just full of people and people living, cooking, smoking, eating, praying. It was like overwhelming, but it's like a community in its own city in Al-Aqsa Hospital. This young girl, she was staying and her family staying very close to where we were staying, the international volunteers, and we would always walk past, and she would always say hello, and yeah. And she has on her bracelet there. I don't know if you can see, that was a gift from some Australian children who they handmade them, and we passed them out. Again, resuscitation room department in Al-Aqsa. This is from my first mission there. This young boy, head injury. I'm not sure, I can't tell you where from. But yeah, he came with head injuries, and that's obviously his father. He survived, and I saw them for the rest of the time I was there. But this is, yeah, a very powerful moment for me, really. She come in on my second mission. What would happen is when we were taking some rest, not me, because I'm not really that important, but the international medical volunteers, if they want to take some, you know, to sleep or eat in where we're staying in a hospital. If we heard explosions or, you know, distant bombs, we knew we had 20 minutes to get downstairs, and it was like clockwork. So you'd hear, and then our kind of I wouldn't say leader, but one of the heads of our sort of group, we were like, right, 20 minutes, guys, and we have to be downstairs. And just like that, we'd be downstairs. 20 minutes later, mass casualty event, and it was all hands on deck. This young girl, she lost her arm in an explosion, in an Israeli bomb, and she was only, like, morphine is really hard to come by as well, if not impossible. And so most of the pain management, I'm not obviously I'm not a professional in a medical professional. I'm aware I'm speaking in a university for, you know, a medical university, so I can't speak too much, but there's not much medical pain management. Ketamine was probably the most common thing used, and if even then it was very hard to come by. I followed one of the doctors to acquire some, and it's a whole long process, and because they have to obviously triage and if it's important enough for the patient. But yeah, she luckily did have some ketamine, and she survived as well. This is an aftermath. Okay, I'm finishing, yeah. This is the aftermath, very common sight, and of a mass casualty event. And again, another unsung heroes is the cleaners. This will be cleaned in 10 minutes and ready for the next patients. I will speed it along. I've been told about the time. So I know Steve spoke about the community mental health workshops. This is one of my one I attended with Med Global and MeWe International. One of the most powerful moments of my life, really. And the female and with the kid there in the blue, after we did the workshop, she said, you helped us forget about the war for 1 hour. And yeah, even now it gives me kind of hairs on the back of my neck on a moment. This is Fatima. She was born 24 weeks premature. Her mother went into labor early because of the house was bombed. She lost her family, so it's just the mother and Fatima survived at that moment. She was 550 grams, 9 ounces, 19 ounces maybe. I don't know the imperial. But she also sadly died. Just quickly, this is where I started getting inspiration for my book, Children of Gaza, The Kite Still Fly, because this is the moment where we were walking back to the house, and they all ran over to us and asked us, like, you know, where are you from? And I said, I'm from England, and these kids are like, started telling me all the English football players they know, and they're like, hey, do you want to play? And I was like, yes, obviously. And so, yeah, we just started playing football, and it was surreal. And it, like, for a moment, I kind of forgot where I was, and it reminded me of my own childhood. And we just the same, just using jumpers or poles for goalposts, and just passing the ball around. And you know, it was a memory I will never forget. And this is where I got the inspiration for my book. I don't know her name, sadly. I tried so hard to find out, but this was in the pediatric department, and her father, we was walking past, and I asked her father if I could take a picture, and he said, of course, and he tried to wipe her tears and ask her to smile, but she didn't want to smile, and I didn't want to make her either. She's, yeah. And this is Dima, and she lives in a hospital like many other kids. She lives there, and she went in as a patient with severe injuries, and she kind of never left. And she's just part of the furniture now, and she's sheltered with her family in Al-Aqsa Hospital. Towards the end of my trip in Gaza in the second mission, I met this kid. I just think it's such an amazing photo with his mother in the background, looking so proudly on him. Yeah, again, these beautiful children who just happy and just want to share and show me their donkey and their toys, and it was just want to play, and it was, yeah, it was another beautiful moment. Just before I run out of time, I want to give a dedication, really. These are the medical students I met, and I know this has already been mentioned, but these four especially, they work for free. They volunteer. Some of them they're coming from the north. They have no houses. They live in tents. They have to still find food. They have to still find water, and they still come into work into Al-Aqsa, and they still have smiles on their faces, and they still save people's lives, and they still help me to feel welcome. And if they saw that if I was feeling a bit nervous, they'd be like, chill out. Yeah, I speak to these four nearly every day. And I think about them every day too. And this is hopefully my book, with many more photos, many more stories, and many more anecdotes. Yeah, but thank you again for listening. Hello.
That was incredible. Thank you. Wow, that was so moving. We have a couple of questions before our next speaker. So what story or emotion do you most hope to convey through your photography of the children in Gaza?
Defiance, resilience, defiance. That's the one thing that really stuck out to me, and the more I witnessed it, the more I looked for it, the more I saw, and just how everyone, but my project was on the children of Gaza and how they just carry on and they still want to have fun and be naughty, be happy, have joy, and yeah, that's it.
Thank you. How do you navigate documenting conflict without reducing the subjects of your photographs to mere symbols of suffering?
I think how I get to know my subjects as much as I can on a personal level, so they don't become objects. If I take a photo, I don't want to just take a photo and run away. I will always find their story. I want to tell their story because I'm genuinely interested in their story. So really the photo is kind of more the tip of the iceberg of what I want to know. And yeah, they definitely don't become objects.
Last question for now. In your experience, how do children in Gaza use art or creativity like kite flying to express resilience in the face of hardship?
I mean, yeah, I mean, one of the things I was in awe with was during the time of Ramadan, and this how many kites were in the air, thousands. Oh, that's maybe exaggeration, hundreds, and just for the eye, you could just see it across the sky, and especially when you have the drones flying and there's buzzing and droning and constantly droning, but then you see these beautiful kites flying high. I remember I saw one of the, and they make these out of just plastic waste, and one of the kites I saw flying, and it was from a bio-waste bag, and it's just from bio-waste, and I was like, that's so beautiful, and it's so symbolic, and everyone just knows how to make these kites, and I don't know who teaches them, but they're so beautiful. Yeah.
Wow, thank you. Thank you so much.
Sure. So I have the honor to introduce Sarah, who Steve actually introduced already, and I can't do his introduction justice. So I'm going to welcome her up to the stage, and please welcome her. And
Hello, everyone. My name is Sarah Seso. I'm 18 years old, born and raised in Gaza in the Rimal neighborhood. My life before the war was normal. I had just started my last year of school and was thinking about what I want in the future. I used to play volleyball at the school and go horseback riding from time to time. I lived in cozy house with my family, 4 sisters and 4 brothers. Unfortunately, I lost two of my brothers, Ahmed, 15 years old, and Muhammad, 8 years old. It's happened in December 7. I had just cut my hair and went to show my sister, she's my older sister, Farah, my new hairstyle. I was chatting with my sister and my cousins and my youngest brothers. Ahmed called me to bring Muhammad from the house yard because he was scared of the bomb sounds. I had just stepped out the kitchen to get Muhammad when suddenly everything went black. I was screaming. But no one could hear me. I couldn't walk because my feet was burning. Ahmed was killed immediately. My other brothers and I were caught in the middle of fire. And my father pulled me out. That's when our suffering began. Ahmed passed away 5 days later because we stayed at the same bombed house. I stayed there for 90 days without proper medical support to my critical case. Afterward, I moved to the hospital. It was out of service, but at least it was a hospital. On January 20, we evacuated from north to south. My sister Sam and I realized then that it would be a journey of death because the IDF was surrounding the area where we are. We struggled a lot as we tried to reach the south. We stayed one night on the medical tent, and in the morning we went to Rafah crossing border. We stayed there for 17 days, and in February 6, I was moved to the US by medical plan to Northwell Hospital. I stayed for 3 months in the ICU burn unit, and right now I'm undergoing occupational therapy 3 times a week. That's my story in short. Thank you for listening.
So I think that was extremely powerful for everyone in the room. And hearing Sarah tell her story, if you can't feel utter shame for how we go about our days without the people of Gaza in our hearts, in our minds, and the people around the world who are suffering, then we have to question our own humanity. And that's what's bringing the tears to my eyes, the utter shame that I feel, that I can go about my day without this constantly on my mind and without putting in the most effort that I can to do all that we can do. Thank you.
Yeah, so now we can have all 4 of our speakers come up on the stage. I'll grab 2 more chairs and we can have questions and answers from the audience. Okay, so we'll have the first 3 speakers will come up. So we need 1 more chair. I see one coming. And you have to be at this end of the, yeah, from, not beyond the table, because then people on Zoom can't see you. So yeah, right there is perfect. And Abena is going to bring the microphone around. So if you have questions, just put your hands up and she will get to you in turn. Maybe if, while people are thinking of questions, oh, is there a question? Okay, yeah. Where is there one in the back? Yeah, I see it.
Please, when you ask your question, please do indicate who the question is to and make sure it is a question. Thank you.
Hi, my name is Rafat. I want to thank you so much for this amazing event. And so I wanted to ask every individual how, I mean, you mentioned how can we help, and other than donation, other than stuff like that, what do you guys think is the most effective way of actually doing something that can make a difference, that can actually, on an individual level, or if an individual can make a big difference? That's the question.
So I think for me, I think one of the greatest individuals, or the greatest individual that ever lived on this earth, would say the weakest way to change things is with your heart, right? The next way you can change things are with your voice and your words, and then there's physical action. So I think everyone needs to find a way to help. And I think HEAL Palestine and Steve's way of approaching humanitarian causes, and how he's set this, the way to take care of these children who come here. He gives everyone the opportunity to do whatever they can. And he counts on the people in the community to deliver. So I think finding ways you can help, it doesn't always have to be monetary. And it doesn't always have to be physical, right? First, put it in your heart, put it in your mind. Second, put it in your words, and at the end, put it in your actions. And just make sure whatever you're doing is sustained, and that you have the right intention when you're doing it, because otherwise it becomes meaningless.
Well, thank you. I don't have much more to add, other than I think what we have here on three of us on stage with kind of diverse ways of being involved here. Dr. Syed, went to Gaza and went to Palestine twice, and used his skill set as a surgeon to help people. And each of you everybody has a skill set in different ways. We have people here tonight who've housed and taken care of our kids, opened their homes, taken them to their appointments, simple things like that aren't so simple because it's making such a difference. So everybody has their own way of helping and being involved and being active. You don't have to be a plastic surgeon. You don't have to be a professional photographer. Whatever your skill set is, apply it to what you can to help those. In Tom's advocacy and the way he's documenting the humanity of the Palestinians and the people of Gaza is so critical. I think it's absolutely important that we humanize the people that have been dehumanized. This genocide couldn't happen without years and years of dehumanization of the Palestinian people, especially the people of Gaza. And what Tom's doing is undoing that dehumanization. So we no longer see these people as just statistics or victims or subhuman, but just like us, like our children. You heard Sarah speak. God bless her, the beautiful Sarah. And that's the words and the experience of somebody who went through such a terrible incident, or she lost her brother. Her home was bombed. She's went through so much painful suffering, and yet she's kept her humanity, and she's kept her courage, and she's so brave. And that's the kind of things that we have to accentuate. We have to constantly share those stories. So all of you, we have these tools today in modern history that never existed before. The way to share information, the way to communicate and connect with people, the way to let others know what they may be ignorant about. And their ignorance can result in a genocide happen. And we can undo that. So the important thing is, as Dr. Syed mentioned, do something, get involved, find your skill set, find a way to apply yourself to this issue. Many of you are going to be physicians. Don't lose your humanity in this capitalist healthcare system that we have. It's so easy to do that. You know, the least you can do is be the kind of surgeon and person that Dr. Syed is. That's not the least. He's a great man, but he's contributing and serving a cause by dedicating himself and putting his life at risk to help others. So I have so much respect for him and his courage and his humanity. Those are things that all of us can emulate in whatever field that we're in.
I see another question up there.
I just wanted to
Oh,
give an
sorry.
example of one thing that someone did. Sorry to take the mic from Tom, but like you think like what Steve said, find what you're good at and offer it. So one of our friends, for one of the patients who's here from HEAL, he's an engineer and he does 3D printing. So he built a mechanism for her, a clip for the bicycle so she could clip her prosthesis on and ride her bicycle. So the things that you may not even think of that can help can actually change someone's life. And it can be something totally small. So really look within yourself and look at what your skill set is, see what makes you happy and do that. And you can bring happiness to someone else.
Hi, Townsend Cock. I'm a student at Columbia, but I worked in congressional advocacy for medical evacuations and other things since February. So it's good to see you, Steve. I understand that a big problem is getting companions issues resolved, and that there is a lot of congressional and State Department intervention that is necessary to break those, barriers. Have you thought about, getting more public, like bigger political campaign around this? Because I feel like it flies under the radar, and it's such a big thing that's keeping so many children from getting care and causing them to have really life-changing injuries. Like, could you talk about what the public can do?
I think that's a great question. And I think just to remind everybody, I think what he's talking about is the evacuations of injured children out of Gaza is often thwarted or denied because of the companion. And we only bring moms or grandmoms or older sisters with the children. We don't bring men. We don't bring older brothers because they're not going to give visas to the U.S. And it's for other reasons, putting them with host families and so on. It's much easier. But the point is that a lot of times the kids are approved, but their moms are not. And they're denied the right to be evacuated for medical care, even in cases where they've been accepted for treatment in American hospitals for free. As I mentioned, we have 10 kids who've been waiting for months, who've been denied because their moms have been denied or their companions have been denied. And it's for security reasons. Now, security reasons in Israel can mean anything. Nobody knows. Not even the courts in Israel know what security means. There's tens of thousands of people who've been and are in prison now in Israel without charge, without going to court, under administrative detention, having a charge of security against them, and they don't even know what that charge is. So that's the same thing that applies here for people who have been denied evacuation out. Critical cases, even the case that Dr. Syed mentioned earlier, that Hala, we weren't sure we were going to get her out because even if we got her passports, the burned girl who died the day before the passports came, we still had to go through this political process. So the question was, would it help to raise this public awareness about this issue? And this is a question we debate all the time, because if our State Department, if the American government, the State Department is advocating on behalf of these kids to get out and come to the US, and they are. My wife is a pediatric oncologist, my second wife. She's a pediatric oncologist and she works for St. Jude, and she's the main person who's leading the evacuation of pediatric cancer cases out of Gaza. And she's evacuated nearly 200 since last October. She works closely with the State Department and the White House, and they're openly advocating on behalf of St. Jude Hospital to get these kids out and put them in King Hussein Cancer Center in Amman and in oncology departments in Egypt. Even our State Department can't get these kids with cancer. They're not injured patients who've been targeted or injured. They're kids who are, you know, have this terrible disease. The majority of them can't get out. So do we start to highlight this and bring it into, make it into a public issue? Because there's a very good chance all that will do is make the Israelis even less willing to cooperate and allow the trickle of patients out. Or it might have the impact that this kind of policy being exposed would create the kind of momentum that would kind of, I don't want to say force them, but make them more lenient towards the whole process of evacuation. I don't know the answer to that. It's a risk we have to take, and we talk about it all the time. Do we make this into a public issue and try to push hard to get these kids out? We went to Senator Warren. We went where the boy who's going to Atlanta, both senators of Georgia intervened directly with the Israeli embassy to get that child and his mother out, and he's been denied 4 times in the past 4 months. As a boy who had his legs blown off. He's 10 years old. So if that doesn't work, is an NGO, a nonprofit, advocating and making it into a public issue, is that going to help? Or is it only going to piss them off so much that it's going to make it more difficult for us to get other cases out that might be approved? If 17,000 children have been killed since last October, and many of them, you saw Tom's photos, in the most horrific and inhumane and cruel way, that hasn't changed the needle on the issue of humanity and how this affects the protection of injured and innocent children in Gaza. Is a social media campaign, is a public awareness campaign about kids being denied the right to travel because their moms are being denied. Is that going to change anything? I don't think it is. The other thing they say to us is find somebody else. And a lot of times there isn't anybody else for a couple of reasons. And many times the families have been killed. We have kids here. We have 2 boys in Boston now. Dr. Syed met me in the Shriners there. Their entire family was killed. They don't have parents. They don't have siblings. They came with their grandmother. We have a girl we just brought to Houston, 11 years old. She lost both parents, 4 sisters and a brother. She has only 1 sister who came with her and an aunt. So a lot of times there isn't a companion, or in the case of a lot of these kids, they're so emotionally attached to their mothers, as you can understand, that trying to bring them with somebody else does more harm than good because of the psychological connection. These kids are as badly traumatized psychologically as they are physically injured, and in many cases even worse. So those are all challenges that we face. I appreciate the question, and it does need to be highlighted. 10,000 injured children in Gaza are waiting for medical care outside, probably more than that. That are documented. And the fact that either medication, medical care, and physicians are being denied entry into Gaza. Dr. Syed was denied entry into Gaza. A volunteer expert surgeon specialist who would go there and provide, how many operations did you do on your first mission there? 60, did 60 operations. Imagine 60 people benefited from this volunteer humanitarian doctor going. Denied entry into Gaza. If that's happening, the issue is so beyond the scope of what we're able to really understand and also, I think, impact on the ground there in a humane way. We can try, but the risk is that it only alienates and angers those who are in power to make it more difficult to help the few that we can help.
Hello. Hi. My name is Joy. I am a second-year medical student here at Stony Brook. Along with many of my classmates here, we would all love to say thank you for being here and sharing your experience with us. It's been really enlightening. So I have a question from one of the medical students who is watching from Zoom right now. Her name is Ifosa. She would like to know, first, she would also like to thank you as well for your experience, for sharing your experience. And she would like to know what it was like, living in Gaza and experiencing these indiscriminate bombings, and, what you think the long-term effects of it are, such as like PTSD for the people of Gaza, but also like for the land as well, like the environmental impacts of these bombings. So that's her question. Thank you.
Hello. Sorry, I didn't catch your name. Joy. Hi, Joy. How was it like to live there? It was, I can't think of a better English word. It was terrifying sometimes. But we were there to do I was there to do a job, it felt like. So I was kind of, it is kind of community based. So like especially when I was in hospital, we were all together, and I didn't feel, I felt only scared when I saw the locals scared. So normally if we heard explosions and I would duck, and everyone just looked at me and thought I was being silly. But when you see the locals running for cover, that's when I was probably most afraid. And obviously, yeah, just hearing tanks and fire and obviously jets going overhead, it wasn't so nice.
So for me, I didn't really go in with any fear. And then I think, as Tom said, when you go in and if you have any concerns, you're around these local people who have been living this now going on up to a year, and they're without fear. And they've accepted their reality as much as they can, and they're trying to function within that reality. And I don't think there's time right now for PTSD because the trauma is still going on. You have people who have been displaced, as Steve said, 7, 8, 9, 10 times. When have they had the opportunity to actually think about what they're going through? When have they had the chance to process 20, 30, 40 family members who have died, entire family names, generations wiped out? They're just trying to live their life. And I think, again, as Steve said, we're going to see the repercussions of this lasting for generations. So it's not just about physically rebuilding Gaza. It's about, trying to figure out how to deal with the long-term fallout of this, which we probably won't understand for many, many generations. And I really appreciate the questions coming from medical students, because when I was in your shoes, it didn't even cross my mind necessarily that I was going to go overseas and help people. I just wanted to help people. And then I think when you're all done, I just, advise that try to find a way that you can help, whether it's here or overseas, to really manifest why you went into medicine.
Hi, my name is Nicole Masad. I am a physician here at Stony Brook. I'm really happy to see all the medical students in the audience. I'm wondering where all the physicians are in the audience. This is a talk that is at a hospital, and I am, for the millionth day in a row, completely shocked to not see any of my peers kind of speaking up or really having any knowledge of what is going on in Gaza. So my question is for Dr. Sayeed. How can we pressure our healthcare systems to do something about not only the healthcare crisis in Gaza and the attack on healthcare in Gaza, but the genocide in Gaza, when seemingly no one cares?
That's a really tough question, because I think as physicians, as a private practitioner, as people who work for the hospital, you have your fears, right? You're worried about your job, you're worried about your future, you're worried about your family. So again, it goes back to doing what you feel you have the capability of doing. If you have the capability of using your words and trying to make change, use your words and try to make change. If you have the ability to act and then publicize those acts, do those things. I don't think we necessarily need to act outside of our comfort zone. Someone was speaking, they were giving a Friday talk a few days ago, and he said, not everyone can do really big things. Many people can do small things, and all those big things and small things add up together. So are we as individuals going to change a massive health system which has to appear to be providing equitable care and putting forth equitable actions. I don't think we're going to change healthcare institutions, but think about the changes that have happened, right? Since in the beginning in October, what went out on medical staff emails, everything was one-sided. But people did stand up and they said, this has to be discussed in an equitable way. What happened? Was it discussed in an equitable way by bringing up what's going on the other side? No, but the discussion kind of is left. And I think in essence, it's what's happening to medicine across the board. As a profession, it's being destroyed, right? We're being run by administrators. The humanity of medicine is being taken away. And it's going to be really up to the younger generations, I think, to change it. And I think it's just speaks to medicine as a whole is, it's going towards EMRs and coldness. It's about treating things, and it's because industry is running medicine, but that's a whole nother discussion. When it comes to this, I think trying to be as vocal as you can, if you feel comfortable doing that. But I think history is going to look back at our hospital administrators. It's going to look back at every physician who's witnessed what's going on. And it's written down somewhere what our actions have been and what we felt towards things. And we're ultimately going to hold some responsibility.
Hi, thank you for everything you've done. For Dr. Sayeed, is there a reason that they denied you going back in for a second time?
So the second journey was through Amman, Jordan. So I flew there. I waited to get entry. So there, the first trip and the second trip varied greatly. The first trip was through the Rafah border. We dealt with the Egyptian authorities and the Israeli authorities remotely by video camera and fingerprints at the Rafah border. The second time around, after the Rafah border was closed for the most part, we have to go through the Karam Sholem crossing. So we would have to go to Jordan. We were not allowed to take any medical supplies. Medical aid workers were allotted 2 bags, 1 bag of personal items and 1 bag with a month's supply of food. Anyone with medical items at the border, these items were confiscated or the person was turned away from the trip. So what happened is I waited in Amman for clearance. I wasn't placed on the list. So what happens, from my understanding, is the World Health Organization will submit a list to Shin Bet and CLA for approval, COGAT, for approval for aid workers to cross. The next day, a list is generated and given to the World Health Organization, and then whoever's on that list can go through. So I wasn't flat out denied, but I wasn't approved. So I never made the list on my first go around. And the organization I went with said, "You're here. We have a team in the West Bank. Why don't you go operate in the West Bank and we'll wait for round 2, maybe 3." So I operated in the West Bank, came back through the Jericho crossing into Jordan and waited there for another round. I didn't make the list on the second round and I didn't make the list on the third round. But again, and this is, I had some people who have some level of connection with COGAT. They looked into it and they couldn't even get answers. The organization I went with had attorneys on the Israeli side who were Israeli attorneys and they couldn't get an answer. There was a journalist who was involved who got a message back from COGAT saying, we don't deny humanitarian access to Gaza. So essentially it comes down to gaslighting. Okay. I mean, again, everyone in this audience is educated. Don't fall prey to being told otherwise, that you're ignorant. So it comes down to gaslighting, but again, everything happens for a reason, and I strongly believe that. I was able to witness the West Bank and have my eyes open to the situation there. I was able to witness the difficulty that the Jordanian Hashemite organization has in transporting supplies in. I was able to go visit their warehouses, meet their administrators, and meet some of the other organizations in Jordan, the heads of the organizations. So it was an experience that, again, that I could bring back and share. And you go to these warehouses and you see that they're not allowed to bring tents in that have metal poles, because the Israelis feel that these metal poles on the tents have dual purposes. So how's someone going to hold up their tent in any strong way? The winter is coming. It's going to be cold. There's going to be winds near the water. So again, it's a matter of bearing witness, and I think everything happens for a reason.
Steve, what happens to the kids after they're done with their medical treatment?
That's a great question. So we have 21 kids that we've gotten out in the last few months for free medical care in the US. And 3 of them were here tonight, 2 are still here, Sarah and Mara. And we not only bring them, they have long-term care. Like Sarah's been here for since February. Yeah, February 6th, and still has 3 appointments every week for rehabilitation. So she's not done with her treatment. Mara just arrived. She's going to be here for months as well. So most of the kids are here for a long period of time. But even for those who finish, Gaza's closed. And there's no chance for them to go back and be reunited with their families. Some of their families are in Egypt because they were evacuated. And some of them, don't have family left at all. What we're doing is either keeping them here until Gaza opens and putting them in school, providing them mental health therapy, keeping them connected to the communities, supporting them, or they're going back to Egypt and we provide them support there. We just sent a family back who had kids still in Egypt. The mom had left 2 kids there and came with 2 kids here, got her son treatment, went back and was reunited with her children, who stayed with her sister. We have them in an apartment. We put them in school. We're supporting them until Gaza opens. That's the best we can do considering the situation. But in any case, our main intention is to make sure the kids get as much care and support as possible. For Mara, for example, she can stay as long as she needs to, because her care is going to be lifelong, right? She has to have legs built. They have to be adjusted. They have to be repaired. She has to learn to walk. She has to learn to use knees again, how to, balance herself. There's a lot of occupational therapy involved. It's a long, 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 long road ahead of her. Thank God she's strong. She has a great spirit, a great attitude towards it, but months, if not years. And all of our kids are like that. We are bringing out some of the most horrific injuries that you can imagine. And we're dedicated to getting these kids the holistic care that they need. And if they need to go back to Egypt, we take care of them until Gaza opens, and then we'll help get them back there as well. We also have set up a fund for every one of our kids. I think we're the only organization that does that. So every one of these kids who comes here has a specific fund that 100% of the money, if you want to donate to Mara, you want to donate to Sarah, that money goes for them, for their education, for their housing, for their basic humanitarian needs later. And that they will be able to, hopefully have some support in the future that will enable them to readjust back to whatever life faces them when they go back to Gaza.
We'll take one more question and then we'll go to the action items, because I know everybody in this room wants to know the specific ways in which we might want to take action.
Hello, my name is Rayanne. I just wanted to say thank you, first of all, because as a student of Stony Brook University, we have received a lot of negative consequences and resistance when trying to voice our freedom of speech through peaceful protest. So to see you at the heart of Stony Brook is really encouraging. My question for all 3 of you, I guess whoever can answer it with the most information, is inshallah, when this genocide is over, how, and more importantly, who is going to be responsible for rebuilding Gaza?
Nobody knows the answer to that question. The future is unclear right now. The genocide is ongoing and there's no end in sight. They killed the chief negotiator, so that kind of undermines the whole negotiation process. There's no indication that anytime soon there's going to be any kind of ceasefire, let alone an end to this bloodletting and this, constant killing. So it's hard to give an answer as to what the future of Gaza looks like. I think all we can say is that the people of Gaza should determine their own future, just as the American people and the English people determine their own future. And they're not less than us. They have the same rights. And that should be within, parameters of equality and not doing harm to others. And that's I think that's the only basis of any just resolution to this ongoing conflict. But there's no answer to who's going to rebuild Gaza, or even if Gaza will be rebuilt. We all know that there is a significant stream in the Israeli political establishment that doesn't want Gaza to be rebuilt at all. They would like to see those people out or live in any manner that doesn't give them privilege or rights. So we don't know. All we can do is keep working for justice, for freedom, for equality, and independence. And that's all we can do. And hopefully things will work out in the right way, because the alternative is quite scary and horrifying. We've seen a horrifying reality over the past 11 plus months. And I can't imagine another 11 months or even 11 days of this ongoing historical injustice against the Gaza people, Palestinians. I don't know if you guys heard her story, but she's expressing great dismay at the political establishment of the United States, which I think everybody shares in this room. I don't think you should look towards the political establishment of the United States for any hope of a positive resolution to the Palestinian question. Both parties have shown that they're not at all concerned about the welfare of the Palestinian people, the protection of the Palestinian children. And therefore, we shouldn't put any kind of hope in that any change politically is going to have any relevant impact on the policy that the American government follows towards the Palestinian people and towards peace in the Middle East. I think if you want to have an impact on this issue, you have to find a way outside of a political, kind of this political path towards hoping the Democrats follow what the majority of Democrats want to see, which is either an arms embargo or an imposed ceasefire. The Democratic establishment's not interested in listening to the will of the people, and which shows exactly as you said, they have special interests which are influencing their policy, and it's not based on democracy, and it's not based on the will of the American people. If you are truly concerned, and you are, everybody in this room is, you wouldn't be here if you weren't truly concerned about this issue. Don't look towards anyone in politics to have a positive impact in resolving this issue. We have to do it ourselves. And, we have two gentlemen here who've demonstrated the ability as individuals to have a positive impact. 60 people in Gaza had surgery thanks to Dr. Syed. Tom is doing advocacy, and his book is amazing. And I think, is it for sale by now? Is it? It's fundraising for it, which I hope we could do tonight to support it. It's great. And that's the kind of work that we could be doing. Have this kind of impact. The politics in America is hopeless in so many ways. You're choosing between, I'm sorry, this is my opinion. I'm not speaking for anybody on the stage or my organization. We're choosing between a fascist and a bought off, fake party.
Okay, great. I know that there are more questions in this room. All of those questions should be asked. You can look to your left and your right. This is now a community. We've spent time together. We've heard all of this information, all of these testimonies. We are accountable to each other for what we've heard tonight. Make a connection with somebody here so that you can continue to ask these questions over time. Let this event be a seed that can grow in a number of different ways, in your own lives and in our institution. Thank you. We have some action items.
Hi, guys. I'm Raisa. I'm a medical student here. So I wanted to bring your attention to the last item on this list, which is fund doctors, not bombs, and how we can support the future healthcare system of Gaza and the current healthcare system. As you may or may not know, there are a lot of displaced medical students, and we're trying to raise approximately $40,000 in stipends for 200 displaced Gaza medical students who are currently in Egypt and also going to other places to receive education. This is in conjunction with the Union of Gaza Medical Students Initiative, Palestine Empowerment Fund based in UMich, and also Medical Students for Justice in Palestine. That's our Instagram. Please feel free to follow, ask any of, we have a few people part of that org actually here right now. So feel free to ask about the organization, how you can join, and how you can invoke action in this academic setting and also in an activist street setting. Yeah.
I'm just gonna talk a little bit. I'm just gonna talk a little bit about the Asian American Institute for Research and Engagement. If you go onto social media for AIRE, www.aire.org, you can find out about the different events and activities we're doing. Here in Long Island, we just completed a field study after October 7th on Muslims who are going through Islamophobia and what the impacts were on them speaking out for Gaza. So these are some of the studies that we've done. So you can see it on our website. And if you can follow us on social media and just see the different things we're doing, and hopefully you can get involved locally with some of the work that we're doing.
And then support this wonderful book. Support HEAL Palestine. You can donate to HEAL Palestine. The list of sponsoring organizations that were on the flyer. If you're at Stony Brook, if you're a student, look at that list of student groups. Join one of those groups. Join, on the West Campus, there are groups that are protesting, asking for divestment. If you're off campus, if you live in the community, look at that wonderful list of groups in the community on Long Island and beyond who have sponsored this event. Get involved with one of those groups. Take some action. Find a way that you can continue this conversation. And as Abena said, spread that seed of this conversation, water it in your community, and let's keep this conversation going because we have to stop the bombs. Ben?
That's it. Let's have one last round of applause for all of our amazing speakers.
To save the